The clinical forensic examination. The clinical forensic examination provides victims of violence the opportunity to protect traces of the incident that would otherwise be lost during healing process, washing the skin, and/or washing clothes. Professional forensic documentation is the key evidence for the court proceeding. To make this possible, the forensic examination needs to be performed systematically and informatively as possible. Trivial injuries such as discrete hematoma might not lie within your routine clinical focus, as it doesn't require treatment. Remember, your examination can prevent further violence. The clinical forensic examination includes the removal of clothes as well as disclosure of confidential information. It is important that forensic physician performs the examination in a separate room without disturbance, interruption, and overheard. Make sure to close the door and attach a "Do Not Disturb" sign on a front door. The room should contain a desk with at least 3 chairs, physician, patient, and accompanying person for the initial interview, an examination couch, a rolling chair, a sink with a soap dispenser and antiseptic materials, kits for DNA sampling, drawing blood, and taking urine samples, paper bags of different sizes for the storage of the collected evidence. Never use plastic bags. Bandages, DNA-free and sterilized scissors, a camera, as well as devices to store and/or prevent the photos. All necessary forms needed to be filled out, pens and colored pencils, if possible, a privacy booth for the patient for undressing, dressing. Examination kits, information on how to compile cost-efficient examination kits for medical practitioners is provided separately. Moreover, the room should be well illuminated and have a temperature that is comfortable for the patient. Floor and furniture must have surfaces that can be easily cleaned. Ideally, the room should be equipped with an alarm button or a device enables emergency calls. A refrigerator for storing blood and urine sample should be available. Enough storage space for other collected evidence at room temperature should be available close by. The refrigerator should be lockable, and it should be in a room that cannot be accessed by unauthorized person. Bear in mind that you will have to store evidence for a long time depending on the legal framework in a respective country. In Germany, for example, samples or evidence have to be stored for up to 30 years. Objective of clinical forensic examination: interpretation and reconstruction of the sequence of events, documentation of the reported circumstances, evaluation of all injuries, documentation of all injuries, documentation of evidence, collecting evidence depending on the injuries, refer the patient to the hospital, discuss further steps and options with the patient, such as contacting a victim support organization and provide them with respective addresses and details. Patient information and informed consent. Prior to the examination, inform the patient about the examination procedure. If they agree to the examination, document this in a consent form that is valid in your country. In cases of an examination ordered by the legal authorities, obtaining consent by the patient might not be necessary, as they have to agree to the examination. Please check your national laws and national medical associations. In this case of low-threshold examination, the patient needs to be informed that all given information is protected by medical confidentiality. If, for example, they want to grant access to the obtained data to their lawyers or any other person, this permission should be explicitly given. Since the regulations for managing data also vary in different countries, please check your national laws regarding this issue. If the patient is accompanied by another person, clarify whether the patient wants this person to remain in the room or if they want the person to stay outside. Afterwards, key facts have to be written down, including name and date of birth, address and phone number, body height and weight, date, time and location of the examination, your name and the name of any other person who accompanies the patient or present in the examination room. Whether the police have been informed and a complaint has been filed. Then proceed to the examination. Ask the patient to report the incident regarding the specific injuries and possible traces. Open questions are preferred, such as what happened, and avoid suggestive questions such as have you been hit with a belt? Ask them to report what happened, when the incident took place, who and or how many persons were involved violently in the act, when and or in which time sequence the act of violence happened, whether any tools or objects were used in the assault, how was the intent of each violent act, which area of the body was impacted, how and how often it was involved, whether any body area is still painful, whether the victim tried to self-defend the assailant, if yes, how, for example, by biting, kicking, beating, etc. Whether any drug was induced or alcohol was consumed by the patient or perpetrator, if yes, when, how much, and what kind of alcohol was consumed, wine, liquor, whether they were unconscious or complained of any degree of impaired consciousness at any certain time during the assault. What happened directly after the incident, for example, treatment of injuries at a hospital or simply taking a shower. Any pre-existing medical condition. In the case of coagulation disorder, for example, an injury might suggest a more violent impact. If the patient doesn't want to answer these questions or is reluctant to do so, note this in the information sheet. General points on the documentation. Document all injuries, irrespective of their size and severity. Be sure to also include trivial injuries such as bruises, even if you consider them irrelevant. Also document all traces of previous injuries such as scars or older hematomas. The documentation of negative finding is of the same crucial importance. For example, if the patient reports that he/she has been hit on a specific area of the body despite no visible finding on the skin surface, make sure to document that the skin is uninjured. Photo documentation generally needs to be performed in front of a neutral background by applying a scale on the same level of the injury, perpendicular to the skin surface, from different distances, taking overview, near, and close-by photos. Make sure that all taken pictures are clear and not blurry. Moreover, in some cases, it might be useful to document findings 2 to 4 days later. In recent cases, there is improved visibility of recent hematoma or abrasion. If patients have taken photos of injuries directly after the incident, ask them to give them to you. Findings should also be described in a documentation form. The form should contain a body diagram where the locations of the finding should be marked. Use different colors to mark different kinds of injuries. Ideally, the same colors should always be used for a specific type of injury. In any case, make sure to have a reference code for the colors you use. Describe the findings as precisely as possible. Take note of the localization of the injuries, the number of injuries within one area of the body. If it is not possible or useful, don't try to count them, but note more than 20 or multiple instead. The type of injuries. Document but avoid any kind of interpretation. For example, write hematoma instead of contusion mark, write abrasion instead of bite mark, or sharp tissue separation instead of cut. The shape and size of the injuries. specific shapes that might indicate the instrumentation used, the relation of injuries to each other, for example, parallel, group, pointing in different directions, shape and impression of the wound edges, the depth of the wound and whether any underlying structure can be seen, such as tendons or bones. The surface of the injuries, the level of the injury in relation to the surrounding skin, observed scabs, the color of the finding, at least the main color, for example, of the wound, any signs of healing. Samples that may be taken during clinical forensic examination include materials and biological samples that are expected to contain DNA from the perpetrator, patient's blood, patient's urine, patient's hair, other samples such as traces from the plants or objects that were involved in the scene, all skin areas and clothing that were in contact with the perpetrator might become contaminated, and accordingly DNA could be analyzed for the perpetrator identification. Keep in mind that remnant of any body fluids such as blood stains, saliva, or semen, as well as hair that contain DNA, should be secured and preserved. Ideally, the patient should bring alternative clothes. The contaminated clothes involved in the incident should be preserved as evidence. Basically, make sure to take DNA samples from visible traces appear on clothing before patient take them off. Please consider that DNA might already be lost if the incident happened several days ago, the victim has taken a shower, or medical treatment has been given. If the victim scratched the perpetrator, traces of their DNA might be found under the victim's fingernails. Take swab samples or clip parts of the nails of the victim, specifically those that were in direct contact with the perpetrator. If samples are taken from moist skin surfaces, use a dry swab. You can use sterile water to slightly moisten the swab in the case of taking samples from dry skin. Seal and label it. Don't use plastic bags, as these will destroy DNA due to decay process. Information on the label should include the name of the victim, time and date of taking the samples, type of the sample, the location from which the sample was taken, who took the sample. Afterward, store the sample in a dry, lockable room. Please consider that there will be different data protection laws in the European countries. Please refer to your national regulations regarding to the need of anonymizing the name of the victim. Blood and urine sample are always taken in recent cases. Depending on the type of the drug, the results of the toxicological analysis are not expected to be positive. If the incident happened some time ago, this is specifically important for the GHB. If you take urine samples, label them as described before and store them in a refrigerator. Blood samples should be stored in a freezer. Depending on the utilized tube, it might be necessary to centrifuge the sample before freezing. Please check the instructions indicated in the supplier. If you take hair samples, cut a pencil-thick bundle of the hair close to the scalp and mark the root with a thread. Tie the hair together here. Afterwards, put the hair in a paper envelope and label it. In any case, be sure to perform the examination in a sensitive, respectful manner and always explain to the patient what you are going to do next. The examination should not only focus on the acute and described injuries. It should be performed systematically from top to the bottom and evaluate the body as a whole. Examine the body areas one after the other and avoid complete nudity of the patient. In the case of low-threshold consultations, the examination should include the whole body as long as the victim agrees to it. If the victim doesn't want their legs or intimate areas to be examined, then these areas should be excluded from the examination. However, this should be documented. Adhering to the checklist might help to perform the examination systematically. You will find the checklist in the description. Injuries will disappear within some time after the incident. The examination should therefore always be performed as soon as possible after the assault. First of all, take a portrait picture of your patient. This is necessary for later identification. The examination should not be limited to areas that were mentioned by the patient. Areas that are usually not visible at first sight must also be examined. Examine the patient's face, head, scalp by moving the hair with comb, the area behind the ears, eyelids, and the oral mucosa. Document all findings by taking pictures and writing them in the documentation form. If the patient reports choking suffocation, perform the standard procedure of examining the stated areas and specifically the eyes, conjunctiva, eyelids, face, oral mucosa, and the back of the ears, and look for the petechiae. Make sure to document any petechiae in a sharp close-up picture. If there are no petechiae at the described location, it is very important to document this as a negative finding. Ask the patient whether the perpetrator used hand or strangulation tool. Be sure to ask this in an open question. For example, don't specifically ask whether the perpetrator used a belt or a towel. Examine the neck and the throat. Check for any kind of erythema, hematoma, abrasion, or patterned impression. The shape and the size of the finding might indicate the position of the hands or hands of the perpetrator. The utilized tool might have left a specific mark behind. Ask the patient about the perpetrator's position during the assault and report the answer as a statement of the patient in the documentation form. Examine the inner side of the hands and nails of the victim for erythema, abrasion, or broken nails as a way of the victim to free themselves. Examine the face in general and check for cyanosis or swollen face. Petechiae in swollen face are unstable temporary finding that disappears soon after the incident. Therefore, timely documentation of these findings is of extreme importance. Ask the patient about loss of consciousness during the assault, urinary or fecal incontinence during the assault, sore throat after the assault. Always remember, only document, do not interpret. After examining the face, ask your patient to undress the upper body. Don't forget to always explain what you are going to do next. For a thorough examination, the upper body should be completely undressed. However, in any case, respect the patient's wishes regarding the extent of undressing. If a female victim doesn't want to undress completely, ask whether she would agree to the procedure while being dressed with a bra. In this case, ask to slightly move the straps of the bra and check the underlying skin. If a female patient agreed to completely undress, you want to document a finding. For example, on the décolleté, ask the patient to cover her breast with her hands. If there are findings on the breast, however, document them, but as stated before, respect the victim's wishes if she rejects the examination. As part of the standard examination, closely check all the visible parts and all hidden areas, such as the inner side of the arms, the armpits, or the area between the fingers. Document all findings regardless of their appearance, age, or severity. And as stated before, do not forget trivial injuries such as bruises. Reported sharp violence. For the documentation of cuts, scratches, or scars, it is important to remember that some patients might report that these injuries were caused by another person. There are characters of injuries, specifically cuts, which indicate that they were self-harm acts done by the individual themselves. Some of these are multiple cuts or scars running parallel to each other, chessboard pattern, existence of several superficial cuts. Please refer to specialized literature for a thorough insight on possible clinical presentation of self-harm. Keep these factors in mind and photo document findings, such as chessboard pattern or a longer injury that is divided by the areola, in a comprehensive picture to allow correct interpretation by a forensic medical expert who will evaluate documented findings. Do not interpret, only describe. After the examination of the upper body, ask the victim to cover the upper half of the body and now to undress the lower half. In the same way, for standard examination of the upper half, closely check all visible parts and all hidden areas of the lower body, specifically the inner side of the legs and the soles. The scan of the genital area is only checked if the patient states that there might be injuries. However, the genital area and the buttocks should be briefly inspected. The gynecological examination of the victim of the sexual assault is not part of this training. For this procedure, please refer to the provided link. In cases of reported blunt force, examine all parts of the body where the patient indicates to have been assaulted and look for hematoma, erythema, abrasion, swelling, wounds, etc. In findings of an abrasion, check for an accumulation of epidermis. If observed, make sure to take an overview picture and close-up. If a tool was used during the course of the attack, the size and/or shape of the lesion might be arranged in a way that reflects the surface of the tool. After the examination, ask the patient to dress again. Refer them to a hospital for treatment of any open wounds or to medical expert for follow-up examinations if required, for example, in cases of suspected fractures or suspected internal bleeding. Discuss further options with the patient and provide them with contact information if available, flyers, information materials, police information, and victim support groups. Store the samples in a safe place. Please remember that blood samples may need to be centrifuged before being stored in the fridge. In any case, make sure that all samples and documents are labeled correctly. Transfer or taken pictures to the hard disk and label them.